Welcome to our Equity and Social Justice Series, COVID-19 Vaccine. My name is Freddie Polanco Walters, and it is an honor to be moderating this distinguished panel today. And a warm welcome to all joining us for our discussion. We are joined by Dr. Sarimer Sanchez, Dr. Joseph Betancourt, and Dr. Leonor Fernandez. Dr. Sanchez is an infectious disease physician who serves as Infectious Diseases Bureau Director for the Boston Public Health Commission. Dr. Sanchez recently completed a fellowship in infection prevention, hospital epidemiology, and antibiotic stewardship at Massachusetts General Hospital. Dr. Betancourt is an internal medicine physician at Massachusetts General Hospital, where he serves as a Senior Vice President of Equity and Community Health and is the founder, senior advisor, and faculty of the Disparities Solutions Center. And Dr. Fernandez is a primary care physician at Beth Israel Deaconess Medical Center, where she serves several diversity, equity, and inclusion councils and the COVID-19 Vaccine Command. To my distinguished panel, welcome. The following questions will be actually have been collected by El Planeta from their readers. They're all trying to understand more about the facts and evidence behind the COVID-19 vaccine. So today, our hope is to collectively dispel any misinformation circulating within the Spanish-speaking communities. We will start with you, Dr. Sanchez. This question is actually around trust. And the question reads, why should I trust a vaccine that was developed so fast? If I have an underlying condition, can I get the COVID-19 vaccine? Is it safe?
Thank you so much. I first want to just start off by saying that as an infectious disease doctor, I really am excited to say that these vaccines are safe. And if there's anything that anyone can take away, that's the one thing I'd like for everyone to remember. First of all, vaccines must be safe and effective for the Federal Drug Administration to approve them. And they go through more testing than any other pharmaceuticals or medicines. Now, in the past, vaccines have taken many years to develop. However, the relatively quick development of this vaccine does not mean that any necessary safety measures were skipped. And there's actually several reasons why the vaccines were developed faster than other vaccines. First of all, a lot of it's that the researchers used existing clinical trial networks, like those that study HIV treatments and other vaccines, to begin quickly conducting the COVID-19 vaccine trials. And another critical piece has also been the investment in manufacturing, even before the COVID-19 vaccines were proven to be effective. And so the US government and vaccine manufacturers have invested millions of dollars to scale up vaccine production while the clinical trials were in progress, greatly reducing the amount of time between vaccine authorization and vaccine implementation. And because of the great financial risk, the investment in manufacturing normally doesn't happen until later in the development process. And so those have been some of the major factors that have allowed this to happen quickly. And mRNA vaccines are also faster to produce than traditional vaccines. And then finally, given the unprecedented public health emergency that we're facing, both the FDA and the CDC prioritize the review, approval, and recommendation of COVID-19 vaccines. And so even though they were developed and released on a very accelerated timeline, COVID-19 vaccines are being held to the same safety standards as all other vaccines. And so that's the first piece to that question. Now, with regards to the underlying medical conditions, adults of any age with certain underlying medical conditions, such as diabetes, heart disease, obesity, and lung disease, are at increased risk for severe illness from the virus that causes COVID-19. And if you have any of these illnesses, getting vaccinated is actually essential to protect yourself. And that's why adults with certain medical conditions have been prioritized to receive the vaccine. And both the Pfizer, BioNTech, and Moderna vaccines were tested on patients with these medical conditions, as well as patients from a variety of racial and ethnic backgrounds, and shown to be safe. And if you have any questions about the vaccines and your specific medical conditions, you should definitely talk to your doctor to make an informed decision. But in general, our mRNA COVID vaccines may be administered to people with underlying medical conditions, provided they have not had a severe or immediate allergic reaction to any of the ingredients in the vaccine.
Great, thank you so much, Dr. Sanchez. And you spoke about vaccine development. So I have a follow-up question from our viewers, which is, will I be required to be vaccinated for work? And can I choose which COVID vaccine I want to get?
That's such an important question. So when it comes to the vaccine requirements, we currently do not know of any plans to make the COVID-19 vaccines mandatory at the government level. And the Biden administration has said that it does not plan to make the vaccine mandatory throughout the US. And we know that the decision to vaccinate is a very personal one. And we know that mandates can make this process even more difficult and stressful for everyone. Therefore, our focus currently lies on encouraging the public rather than mandating, and really honing in on vaccine education campaigns and making it easy and accessible for everyone to obtain the vaccine when they're eligible. Now, in the future, some employers may require or mandate that workers be vaccinated. And if employers do require COVID-19 vaccinations, their policies must comply with the American with Disabilities Act, the Title VII of the Civil Rights Act of 1964, and other workplace laws, which generally include medical and religious exemptions. Now, as to the second question about whether patients can choose which COVID-19 vaccine they get. So although patients will always be informed of which vaccine they are receiving, right now at this moment, patients are not able to choose which vaccines they receive, and this is largely due to issues in vaccine availability. Now we know that the two current available vaccines are very similar and that they both require 2 doses and both have been shown to be over 90% effective. And so what the Massachusetts Department of Public Health and the CDC have emphasized is that primary care physicians should have that conversation with the patients if they're concerned about any of the vaccines.
Great. Well, thank you very much for all that information. That's really good to know for our viewers. Now, Dr. Betancourt, pleased to have you here. The viewers would like to know the following. Can I get the COVID shot at the same time as other vaccines? For example, the flu vaccine, and are there risks of severe allergic reaction to that?
It's a great question, and thank you so much for having me. I want to thank El Planeta and thank Harvard Medical School as well for sponsoring this, and it's always a pleasure to be on with my friends, Leonor Fernandez and Salimar Sanchez. So, we are committed to the community. I think that's the biggest message in getting our community the information they need to make the right choice for them. But I think we are all committed to getting our community vaccinated because we know that is the path back to our normal lives, and especially given how hard it's hit our community. So it's with that backdrop that I'll say a couple of things. We believe in vaccines. Vaccines have been tested. Dr. Sanchez has talked about this, and we believe in the extensive testing that's been done with this vaccine. And so we follow recommendations from the Centers for Disease Control that provides recommendations on how to get vaccinated, when to get vaccinated. And for this vaccine, as Dr. Sanchez has mentioned, depending on which one you get, right now, you need to get both vaccinations to get the full effect, right? So if you get Moderna, you're going to get 28 days in between the first and second dose, and we absolutely need the second dose. And if it's Pfizer, it's going to be 21 days. Now, the CDC that provides these guidelines has recommended that you not get another vaccine 14 days before the first one, not in between, or nothing till 14 days after. Now, we believe the flu shot and the flu vaccine is incredibly important. So, and other vaccines are critical, but, we have to follow the recommendations that have been done so far in the studies, and those are the current recommendations. So get your vaccines, but really space this out. Get your 2 shots, nothing before 14 days, nothing after, and nothing in between. As it relates to allergies, we at Mass General Brigham, our system, we vaccinated over 70,000 employees, and we've been tracking mild and moderate allergic reactions that can range from little redness on the arm, to other mild itchiness, things like that, and all the way through moderate and all the way through severe allergies. And I'll just say that we've seen less than 1%, so less than 1 in 100 people have had even mild or moderate allergic reactions. And the people who've had severe allergic reactions are less than 10 in 1 million. So just to kind of compare, even with some common antibiotics that we take, they tend to give you more allergic reactions than this does. So you will get asked questions about allergies before you get the vaccine. And we also want to let people know that you're going to be observed for 15 minutes so that if you get any kind of allergic reaction, we are going to have healthcare providers there to help you through it, but it's going to be very rare. And we have a lot of experience now. So I think people should feel comfortable that this isn't a major issue that should prevent them from getting vaccinated.
Oh, thank you very much, Dr. Betancourt. And, you talk about the vaccine being a way out of this pandemic. And also, thanks so much for explaining the timing between the doses. I do have a few follow-up questions to that related to the protection of the vaccine. And the question reads, can I still get COVID after my first dose? How about my second dose? How long does COVID vaccine provide protection for?
Yeah, so let's talk about, COVID and the vaccine itself. So when you get the first vaccination, you do not have full protection yet. And so we've had cases where people have gotten the first vaccination and a couple of days later, they've gotten COVID. That could be because they actually had gotten COVID a couple of days before. They got the vaccine, they didn't have full immunity yet, and that's when the symptoms start to kick in, because the symptoms could take anywhere between 5 and 10 and 12 days to kick in. So we have instances where, again, you've contracted COVID, you get the vaccine, then you're positive. And it's confusing, right? Because you got the vaccine, you say, wait a minute, why did I get it? So even after the second dose, we need people to understand that it provides 95% effectiveness, right? 95% is not 100. So there's always still a small chance that you could get COVID. And in fact, what we're seeing is that you can actually test positive for COVID after you've gotten the vaccine, but you won't get very sick at all from it. That's the benefit of the vaccine. And we're studying now just to make sure, like other vaccines, that if you get the vaccine, you actually don't develop enough virus to spread it. But that's that part we're studying right now. So yes, you can. Hopefully that explanation helps people understand why. But if you get both vaccinations, you should have 95% protection, almost total protection from getting sick, although you might test positive. But I think that's a lot better than not getting the vaccine at all. As it relates to the question of how long the immunity, the protection from the vaccine, how long that lasts, well, this is going to be something that we're going to need to study for a longer time. It may be that we find out that we need to give ourselves a booster after a year, just like we do with the tetanus shot, where we have to get a booster at least every 10 years to just help the body kind of make sure it develops enough soldiers, right? Enough antibodies to fight the infection. So we're going to be studying this. We do believe it gives you strong immunity. If you've had natural infection, we think you got solid 3 months. But certainly with the vaccine, we're hoping that it gives us a year. But I think, we're going to be looking at that carefully. We need a little bit of time to figure that out.
Well, thank you very much. It's very clear. And I do agree as well that 95%, that it's much better than nothing. So thanks again. Now talking about vaccine safety, Dr. Fernandez, these questions are around the risk for children and women in particular. Is the vaccine safe for pregnant and breastfeeding women? And does it have any effects on fertility?
Hello, I'm so pleased to join all of you, and thank you also to El Planeta and to Harvard Medical School and my co-panelists. So I think all of us, especially while pregnant, it's a time you want to really, really be careful. That said, we do know now that pregnant women are at higher risk from COVID. So we know that if pregnant women contract COVID, they have a higher risk of hospitalization and also of requiring breathing assistance, what we call intubation. So we know that COVID vaccine still protects pregnant women. And while they were not included in the trials, they have been included in the vaccinations that have been occurring. We know that there are approximately over 15,000 women who have received the COVID vaccine while pregnant. And so the recommendation from the American College of Obstetricians and Gynecologists is that it is a choice that should be given to the person who is pregnant, and they should be weighing their risks of COVID versus what seems to be very likely a very safe profile in pregnant people. And therefore, the recommendation is to discuss it with your OBGYN, but that for most people, the risk of COVID vastly outweighs any consideration of risks from the vaccine. In terms of your other question, I think you had asked about fertility. And so a lot of people understandably want to know, well, could it affect me? And there are no sort of biological reasons that we are suspecting that it will affect fertility, and there's no signal that we're seeing in safety that it does. All of this is being studied very carefully. So as data comes out, we will add to this. But at this time, we think it is a very good idea because it protects the woman while pregnant, which we just described is at higher risk. And also there is some thought that it'll protect the baby when born as well, in terms of, because the mother is protected, it's less likely to be in the household, and there is some transmission of the maternal antibodies to the baby. So for all of these reasons, you can discuss it with your doctor, but generally speaking, all people should be given the choice to get the vaccine, particularly if they're pregnant.
Oh, great, thank you so much for talking about that protection that is passed on to the baby, and actually brings me to the next question, which is, do kids need to get the vaccine as well? Is it safe for them?
That's also a really interesting question. And usually in trials, there's a class of people that are sort of protected. So first, we often try the vaccine on various other groups. So typically children and pregnant people are protected initially. The trials included up to age 16 in the Pfizer trial. So it is approved for 16 and above. So a 16, 17-year-old can receive the Pfizer vaccine. The Moderna and Pfizer can be received as of 18 for both. Right now, the recommendation is that this is being actively studied. There are trials going on right now that have enrolled and actually have completed their enrollment of teens. So we will have more data regarding the safety. So right now, it's not actively being recommended to any individuals under 16. But we will be updating that as the science emerges.
Oh, thank you so much for that information. And, you know, as a pediatrician, I do have a lot of parents asking those questions, whether, you know, their kids could get the vaccine. And actually, Dr. Sanchez, I'm going to ask a follow-up question that I do get from a lot of families. And I'm wondering if you can please walk us through the immediate, midterm, and long-term side effects of the vaccine, if there are any.
I'm happy to, and thank you so much for the invitation to be here along with my other co-panelists. And so the COVID-19 vaccines will help protect you from getting COVID-19. And you may have some side effects, which are normal signs that your body is building this protection and this immunity. And so these side effects often can feel like the flu, may affect people's ability to do daily activities or work, but they really will go away in a few days. And so breaking it down like you're referring to in terms of immediate side effects, most people might have some redness or soreness at the injection site, like the arm that you actually get the shot. And that's actually the most common reaction, and usually, again, will go away very quickly. Other reported side effects that are, again, related to this building up of the immunity are headaches, fatigue, dizziness, fever, chills, muscle aches, and joint aches. And for some people, these side effects were worse after the second dose. That's another thing that a lot of patients have informed us. And again, these side effects, though, will usually go away on their own within a few days. And if patients often take over-the-counter medicine, such as a Tylenol, ibuprofen, to manage the side effects after the vaccine. And what we have known so far is that the effects documented to date are short-term and typical of many vaccines. And the CDC actually just released some data that after administration of 13.8 million doses of Pfizer and Moderna COVID vaccines to the US population, the post-authorization safety profiles for both vaccines are actually very reassuring. Now, in terms of the long-term side effects, at least 8 weeks of safety data were gathered after participants received their second dose in the clinical trials. And there were no serious safety concerns, including deaths, noted in the studies of these vaccines. Now, Based on our historical experience with other vaccines, we know that it's usual for side effects to appear more than 8 weeks after vaccination. So therefore, again, what we know so far is very reassuring. And most importantly, in terms of sort of the learning about those mid to longer term the potential for those side effects, the safety monitoring for these vaccines has been the most intense and comprehensive in US history. And COVID-19 vaccines will continue to be monitored for long-term side effects, which again have not yet been reported for the next few years. And so, we're very committed to gathering this information.
Thank you. Thank you very much for that. And the next question relates actually pretty well because it's something that I know a lot of people are asking. You talk about, people concerned about side effects. So some people, they're very worried that they may get some. So it's really good to hear the reassuring information that has been studied. Dr. Betancourt, if I already had COVID-19 and recovered, do I still need to get vaccinated? It's what some of our viewers are asking.
That's a great question. We hear it a lot. We expect it a lot from our communities, given how hard we've been hit by this. So, first, if you got COVID and you made it through, that's, thank God, that's great. And, but you cannot be careless and you can't assume that the fact that you got COVID gives you protection. What we understand is it is still critical for you at the right time when your time is up within the phases that you get the vaccine, that you get both doses. Why? Because we understand that the vaccine is going to give you even better and even stronger protection, immunity against COVID. And we don't really know how long it's going to last, the natural immunity. We think 3 months. We're going to be studying that as well. So the safest thing you can do in the insurance policy against COVID, and if you had COVID, maybe you didn't have it that seriously, maybe you did, you don't want it again, is to get the vaccine. And so with all the information we've given you, we hope that will be the right choice for you.
Thank you very much. And, the three of you have eloquently provided information that shows that this vaccine truly is safe and that actually will protect you and protect all our viewers and those who get the vaccine. 95%, that's actually pretty good, right? So the final question goes to you, Dr. Fernandez. Do I still need to wear a mask if I'm vaccinated? Since I'm already protected, do I really need to wear do all the safety measures that we were doing before the vaccine came into place?
Also a really great question, and also one that we get a lot, and it's understandable. I mean, we all want to be done with the situation of the pandemic, and it will be liberating when we all can be done with the masks. But unfortunately, even after getting the vaccination, it is not time to stop wearing the mask. And the reason for that is the following, and something that Dr. Betancourt also alluded to, which is so far we know that the vaccine is very effective in protecting us against serious COVID. What we don't know as well is whether it completely eliminates the possibility that we can carry it in our nose and our mouth for a few days and get what we call infected, but not really have much by way of any clinical symptoms. But we know that people without symptoms can transmit the illness. So the reason we are primarily recommending that people continue to wear a mask is because they could still, even though they're vaccinated, transmit the illness to somebody else. The one other reason is with the emergence of these additional variants, until more data emerges, we also think it's a particularly good idea because it also protects yourself. In case the vaccine, which we just heard, is never 100% effective, and there's still a lot of COVID around, and particularly in our Latino communities, I think it is a very wise thing to continue to use the mask to protect all of our community and each other.
Great, thank you so much. That's definitely great advice, and I will continue to wear my mask. And I did get vaccinated, and I hope that our viewers that, their questions that you submitted were answered. I would like to thank Dr. Santos, Dr. Betancourt, and Dr. Fernandez for their time and commitment to our Spanish-speaking community. Again, we hope your questions were answered today and that this session helped inform your decision about the COVID vaccine. Thank you very much for watching.
Thank you.